I can think of one word to describe Deb Campbell, I think advocate.
She's a loving soul. We're very, very blessed to have her.
She's worked extraordinarily hard to develop a program of excellence here at Montefiore Einstein. And she will leave a legacy of excellence.
She's not the loudest voice in the room, but when she walks in, everyone takes notice.
The things that drew me to medicine, one, I was always interested in science. I was actually torn between pediatrics and pathology.
She was the hardest working resident I've ever met. And I was lucky enough that she agreed to be a fellow in neonatology.
Pivotal driving force in my focus on neonatology and dedicating my career to this field has been in part the fact that I've also lived the experience. 40 years ago, I had a 27-weeker who lived for a month and died, and certainly medicine has changed a lot in the last 40 years. And a baby born at 27 weeks has a much, much greater chance of surviving now, as it gave me a different perspective, both not just as the clinician, but as the parent of a really critically ill infant.
Early in her career in neonatology, she recognized that graduates of the neonatal unit required special follow-up, and she developed an extraordinary program called the Low Birth Weight Evaluation and Assessment Program, or LEAP, which has cared for thousands of graduates of the NICUs and trained hundreds of residents and fellows. She also took that experience to develop standards that New York State has accepted as what is appropriate for kids who are challenged developmentally.
She is a champion for pediatrics and women's health, and she knows so much. She's like the ultimate educator. She can take something that's so complex and talk about it in a way that anyone can understand it, and that's a skill.
Thousands of miles away, people still remember who she is, how she made them feel, and what she contributed to their lives, not just as patients, but as other neonatologists as well.
Her spirit is a generous spirit. She wants the best for everyone.
I went into the hospital. Unexpectedly, Sky was ready to enter the world. Only thing, she was going to be born very premature. 24-weeker. She came that early morning in September, and Dr. Campbell greeted me and was very honest. We didn't know what was going to happen. We just took it, minutes by minutes and hour by hour. And Sky, every day she got stronger. Dr. Campbell and her team were amazing.
She's been very instrumental in my life, just over the years checking in on me, making sure I was doing well in school.
Sky is who she is today because of her and her guidance and love. I'm so thankful for her and the team she had surrounding Sky. And I'm thankful, just thankful, very thankful.
Dr. Campbell joined the Committee on Admissions I would say 25 years ago, Deb has an amazing ability to take a situation that demands ethics, integrity, foresight into what we are looking for in a future physician.
For me, it's always been both about providing the best care to the babies, as well as really trying to engage and support families so that they feel part of the infant's care, but that they also feel prepared over time to be able to care for their children and best support them. I think in terms of what I'm most proud of is the connections that I've kept with many of the families over the years, as well as the trainees and the colleagues. We're all a big extended family. It's wonderful when the families bring the babies back to the NICU to visit, or when we have a reunion. And some families I've been able to maintain connections with as their kids have grown through high school, college. We have college graduations every year, getting pictures, and it's really very fulfilling and wonderful to see how these children have grown and thrived, and they're incredible young adults.